So we have with us Dr. Sandeep Gupta, and he specializes in orthopedics. Right now he is associated with Max Hospital Mohali, and he's a very renowned doctor. So it's our pleasure to be talking to you today. Hello, doctor.
Lavan.
So at the MAPICON today, you spoke about bone health.
That's right.
Yeah, so for our viewers, I would like to ask you basic question: what are the few bone related issues that usually happen? Like
So
common
the
one.
most common thing is weakness of bone.
Okay.
Term which we use is osteopenia, osteoporosis. As we grow old, the bones tend to become weaker, and we are more prone to suffer from multiple fractures.
Alright.
Fracture and spine fracture being the main one,
Oh.
and this is because of the weakness. So that is the area of interest, and that is the area of topic we talk about.
Okay. So when does a person know that this is the time to see an ortho? How
To answer your question, bones start to get weak in a patient, in a person after the age of 35,
Okay.
and in women especially, once they have menopause,
okay.
then bones start to get even more weak. Before they visit an orthopedic surgeon for a fracture, it's better that they consult their physician after the age of 45, 50, let's say, and get their bone health first with certain simple tests. And if the physician says that the bones are weak, then they should undergo appropriate treatment.
Sure. And why are we seeing more bone problems in younger people now?
The reason for that is sedentary lifestyle and fast food culture.
Okay.
Our diet has gone bad and we do not exercise a lot.
All right. So diet and lifestyle directly affects the bone health. So any foods you recommend that benefit the bone health?
So, bone health depends on four things. One is calcium intake, second is protein intake, third is vitamin D intake, and fourth is physical effort. So, anybody who wants to have a strong bone has to work on these four things. And if the diet is deficient in any of these things, then the bones would tend to get weaker. I must re-emphasize here, calcium, vitamin D, almost everybody knows is related to bone health. What nobody really cares about is protein intake. And average Indian vegetarian diet is really, really deficient in proteins, and everybody should be vigilant of how much protein they are taking, and it should be adequate.
Okay, but non-vegetarian people might be getting in more the
If
protein.
somebody is having non-vegetarian every day and does not have any other problem, then yes, their protein requirement might be getting.
Okay.
None of the vegetarian diet, if it is not being consumed properly, is sufficient in giving her protein.
But what foods are best for bone health?
So what foods are best for bone health? So any food material which gives you the supplementation of calcium and protein is good enough. So if we talk, then all the pulses, all the sprouts are good for requirement of protein. Then milk and milk products are good for calcium requirement. Vitamin D is made by the skin in presence of sunlight. If it is not there, then you have to take supplementation.
Sure. That's a lot of good insights for us. But what about supplements? What supplements should we taking?
So again, I'll get back to those two things: calcium, vitamin D, and protein. Right.
Okay.
So calcium intake has to be around 1 to 1.5 gram per day. If the diet, we have a lot of apps today. You can dial in what you are taking in and see how much calcium is there. If the calcium is not adding up to what it should be, then you should be taking calcium supplement. Vitamin D, again, most of us, despite living in India, do not have an exposure to sunlight, and most of us, if we get a vitamin D levels done, it would be deficient. So vitamin D supplements have to be taken by almost everybody in urban India. And as for the protein, try to get the supplementation of protein from the diet as far as possible. And if it is not getting okay, then yes, you can think of protein supplements, but under strict medical supervision.
Okay.
Yeah.
What about fish oil? Because I've heard at the gym they say fish oil is really good for bones.
So fish oil per se does not provide calcium, does not provide much of protein. Yes, it has some component of vitamin D probably, but apart from that, does not provide any of the bone structural requirements. What it
Okay.
provides is good fat.
Acha, that solves my doubt. I also think it helps with bones. Okay. But thank you so much, doctor, for
Thank you,
the
ma'am.
good insight. Any last message you would like to give to the viewers?
So
Anything?
as far as bone health is concerned, its prevention is always better than cure. It is better to have strong bones than to get your fractures treated. And best of luck. Follow these simple guidelines and you should have a healthy and pain-free bones.
Yeah. Thank you,
Thank you,
doctor.
ma'am.
It was a